Myself, Dr. Neethu from Government Ayurveda College, Tripura. I am here to present a topic on an in vitro study on the antimutagenic activity of Vatashumga in recurrent abortions. The contents of my topic include the introduction, then about the drug, the Ficus Benghalensis linn, the objectives of the study, materials and methods, observations and results, and finally the summary and conclusions. Firstly, the introduction. As we all know, the recurrent spontaneous abortion, they have been defined as a loss of 3 or more consecutive pregnancies before the 20th week of gestation. And the incidence rate, it is as high as 31%, and about 22% of these abortions, they occur before the pregnancy is clinically apparent. And the risk of these recurrent spontaneous abortions, they increases with increase in age of parents and also with each successive fetal loss. Studies have already shown that mutagens, they cause somatic DNA damages which further results in the pathogenesis of many diseases like recurrent abortions, coronary artery diseases, and also atherosclerosis. Then about the drug Vatashumga, they have been recognized as the effects of Ficus Benghalensis linn. They have been used in practice. To prevent early abortion, to determine the sex of the child, and also for the proper development of fetus. And administration in the form of swarasa, that is the juice of the leaf bud, or in the form of shira kashaya, either nasally or orally. The proved antioxidant property of the drug, they also gives a clue in its level of action. That is, it prevents any further DNA instability. The objectives of the study. First, to evaluate the extent of somatic DNA damages in subjects suffering from recurrent abortion and also to compare with normal fertile women. And second part of the study is to evaluate the antimutagenic effect of Vatashumga in subjects with recurrent abortions. Materials and methods. The study is constitutes of 6 women who had at least 3 consecutive abortions and who have performed various biochemical immunological studies and subjects with normal karyotypes. And a control group including 2 healthy fertile women with live children. Then the method adopted is CBMN assay, that is cytokinesis block micronuclei assay. And this is the procedure. Firstly, 5 ml of venous blood is being collected from every subject, and then lymphocytes from the blood is being separated by adding lymphoprep. Then in the culture medium of RPMI 1640 medium, the cell culture is being prepared and is being incubated for 3 days at 37 degrees Celsius. And at the 44th hour, cytochalasin B is being added to block the cytoplasmic division. Then the white cells are separated at 72nd hour. Then a hypotonic saline of potassium chloride is being added. Then they are fixed and dropped and they are stained and observed under microscope. The micronuclei frequency in 1000 binucleates itself is then counted. These are the observations noted. That is the binucleated cells. The first 2 pictures, it shows the binucleated cell, and in the second 2 pictures, that which marked with red arrow, it shows the micronuclei. Then in the second part of the study, where the culture is being prepared, it includes 3 parallel cultures. The first culture, culture A, which has been kept as a control without adding any of the extracts, and the culture B, where the extract of Vatashumga, it is being added at the concentration of 30 micrograms per ml, and third culture C at a concentration of 60 micrograms per ml, and the same procedure is being repeated. And the same observation was above the micronuclei is also noted. This is the result observed. The distribution of mean CBMN frequency according to the subjects, that is the first part of study. In the study group of 6, the mean CBMN frequency was found at 40. Theoretically, up to 10 is normal, but up to 11.5 can be considered as a normal health. But here 14 is being found. Then the control group of 2, where the CBMN frequency was 11. Then in the second part of the study, where the distribution of mean CBMN frequency with varying concentrations of Vatashumga was noted. Here in the study subjects of 40. In the culture A, the CBMN frequency was 40. In culture B also it was 40. Whereas in the culture C, in the double dose, the CBMN frequency was decreased to 13.5. The same in the control subjects, where the CBMN frequency in culture A was 11, in culture B was 11, and in culture C it was decreased to 10.5. The summary. It shows there is a significant increase in the CBMN frequency in subjects with recurrent abortions. Vatashumga, it possesses antimutagenic properties, thus preventing the recurrent abortions. Further studies in larger groups, they have to be undertaken to ensure this property of Vatashumga. Thank you.